Hello, everybody. This is Margareta Harris in WHO Headquarters, Geneva, welcoming you to our first global press conference for 2022 on COVID-19 and other health emergencies. Today, Thursday, January 6, 2022. We have, as always, a panel of experts to answer your questions, led by our WHO Director General, Dr. Tedros. And with Dr. Tedros, we also have in the room Dr. Mike Ryan, Executive Director of our Emergencies Program, Dr. Maria Van Kerkhove, Technical Lead for COVID-19, Dr. Ibrahim Sosefwal, Assistant Director General, Emergency Response, Dr. Mariangela Shimao, our Assistant Director General for Access to Medicines and Health Technologies, Dr. Kate O'Brien, Director of Immunisation, Vaccines and Biologicals Department, Dr. Bruce Aylward, Senior Advisor to the Director General who leads on the ACT Accelerator, and Dr. Janet Diaz, who leads on Clinical Management Response for COVID-19. As usual, we're translating this simultaneously in the 6 official UN languages, plus Portuguese and Hindi. And so now, without further delay, I will hand over to Dr. Tedros to give us his opening remarks. Dr. Tedros, you have the floor.
Thank you, Margarita. Happy New Year. The dawn of a new year offers an opportunity to renew our collective response to a shared threat. I hope global leaders who have shown such resolve in protecting their own populations will extend that resolve to make sure that the whole world is safe and protected. And this pandemic will not end until we do that. Last week, I asked everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% of people in every country by the middle of 2022. And on top of that, to ensure that breakthroughs, treatments, as well as reliable tests are available in all countries. To end the acute stage of the pandemic, the highly effective tools science has given us need to be shared fairly and quickly with all countries of the world. Vaccine inequity and health inequity overall were the biggest failures of last year. While some countries have had enough personal protective equipment, tests, and vaccines to stockpile throughout this pandemic, many countries do not have enough to meet basic baseline needs or modest targets which no rich country would have been satisfied with. Vaccine inequity is a killer of people and jobs, and it undermines a global economic recovery. Alpha, Beta, Delta, Gamma, and Omicron reflect that in part because of low vaccination rates, we have created the perfect conditions for the emergence of virus variants. Last week, the highest number of COVID-19 cases were reported so far in the pandemic. And we know for certain that this is an underestimate of cases because reported numbers do not reflect the backlog of testing around the holidays, the number of positive self-tests not registered, and burdened surveillance systems that miss cases around the world. While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world. Hospitals are becoming overcrowded and understaffed, which further results in preventable deaths from not only COVID-19, but other diseases and injuries where patients cannot receive timely care. First-generation vaccines may not stop all infections and transmission, but they remain highly effective in reducing hospitalization and death from this virus. So, as well as vaccination, public health social measures, including the wearing of well-fitting masks, distancing, avoiding crowds, and improving and investing in ventilation are important for limiting transmission. At the current pace of vaccine rollout, 109 countries would miss out on fully vaccinating 70% of their populations by the start of July 2022. The essence of the disparity is that some countries are moving toward vaccinating citizens a fourth time, while others haven't even had enough regular supply to vaccinate their health workers and those at most risk. Booster after booster in a small number of countries will not end a pandemic while billions remain completely unprotected. But we can and must turn it around. In the short term, we can end the acute stage of this pandemic while preparing now for future ones. First, we must effectively share the vaccines that are being produced. Throughout most of 2021, this was not the case, but toward the end, supply increased. Now it's crucial that manufacturers and those donating countries share delivery timings ahead of time so that countries have adequate preparation to roll them out effectively. Second, let's take a never-again approach to pandemic preparedness and vaccine manufacturing so that as soon as the next generation of COVID-19 vaccines become available, they are produced equitably and countries don't have to beg for scarce resources. A few countries have provided a blueprint for how high-quality vaccines and other health tools can be mass-produced quickly and distributed effectively. And now we need to build on it. WHO will continue to invest in vaccine manufacturing hubs and work with any and all manufacturers who are willing to share know-how, technology, and licenses. I'm encouraged by some of the vaccines currently going through trial where innovators have already committed to waiving patents and sharing licenses, technology, and know-how. It reminds me of how Jonas Salk did not patent his polio vaccine and in doing so saved millions of children from the disease. Let's also invest and build the public health and health systems we need with strong surveillance, adequate testing, a strengthened, supported, and protected health workforce, and an empowered, engaged, and enabled global population. And finally, I call on citizens of the world, including civil society, scientists, business leaders, economists, and teachers, to demand that governments and pharmaceutical companies to share health tools globally and bring an end to the death and destruction of this pandemic. We need vaccine equity, treatment equity, test equity, and health equity, and we need your voices to drive that change. Equity, equity, equity. No place is this message of equity more true than in countries or regions dealing with humanitarian crisis and conflict zones. In these areas, tackling the pandemic as well as keeping health services on track is extremely challenging. The base requirement for life-saving intervention is humanitarian access. And we're on the ground in every humanitarian crisis and in all instances have found ways to reach populations with aid and supplies. For example, in Afghanistan, until recently, over 3/4 of health facilities reported stockouts of essential medicines, and there was a threat to sustaining health workers in their posts. But as of December, over 2,300 health facilities had received new supplies, and 25,000 health workers have been paid, ensuring the functionality of 96% of the health system through a joint WHO-UNICEF effort, especially the Sahat Mandi program. In Ethiopia, WHO was able to dispatch 14 metric tons of medical supplies to Afar and 70 metric tons to Amhara in December. Two places have been affected by the conflict. In Tigray, WHO has not been permitted to deliver medical supplies since mid-July of last year. This is despite repeated requests from WHO to provide medical supplies to Tigray region, which would help meet some of the humanitarian and health needs in Tigray. Even in the toughest periods of conflict in Syria, South Sudan, Yemen, and others, WHO and partners have had access to save lives. However, in Tigray, the de facto blockade is preventing access to humanitarian supplies, which is killing people. At the top, I spoke of how the new year is a time to renew. I urge all leaders and key stakeholders in conflict to remember that those who work for peace are the heroes history remembers. We need health for peace and peace for health. To build trust and save lives, a good starting point is to ensure humanitarian and health corridors are open in all conflict zones so international agencies and civil society groups can do what they do best: save lives. And to those celebrating Orthodox Christmas tomorrow, may your homes be filled with peace, happiness, and good health. Margareta, back to you.
Thank you, Dr. Tedros. So now I'll open the floor for questions, but we've got hundreds of you online. So I'd remind you that if you, we have to restrict you to just one question. When I call on you, please unmute yourself and ask your question. I'll start questions with Jamie Keaton from Associated Press. Jamie, please unmute yourself and ask your question.
Hi, Margaret. Hi, Dr. Tedros. Thank you very much. Happy New Year to all. My question is about what people should be doing given this rage of Omicron cases. Aside from getting vaccinated, if they haven't already, how can people change their behaviors to help prevent Omicron from spreading beyond what many people were already doing to help stop the other variants? For example, should people be double masking more, washing hands more regularly? Should they stop hugging? Should they spend even fewer moments in a confined space with other people? Or keep a distance, even keep a distance while passing people for just milliseconds in the street? Is Omicron that contagious? In short, what more can individuals do to fight this highly transmissible new variant that is raging in so many places? Thank you.
Thanks, Jamie. I think that's a question for Dr. Maria Van Kerkhove.
Well, thanks, Margaret. I'll start, and others will probably want to come in. But I think this is a great question. You know, people can do so much the power that people have in hands. Thank you. The power that everyone has in their hands to be able to protect themselves and their loved ones has never been more important. What we have advised and what we are continuing to advise is to take a comprehensive approach in knowing what your risk is where you live and take measures to lower your risk to be exposed to this virus, and if you happen to be exposed to this virus, for the potential to pass it on to others. It is about making personal decisions and making decisions for you and your family, and also having the policies to support you in those decisions to be able to keep yourself safe. This is about distancing, keeping your distance from others outside of your immediate household, wearing of a well-fitting, appropriately made mask. Not all masks are the same that are out there. There are masks that are out there that are better than others. We make recommendations on the minimum standards of masks in terms of layers, in terms of the way that they are constructed. There are standards that are out there. So get a hold of a well-fitting mask and well-made mask. And please make sure you wear it appropriately. I've spent a couple of days outside of the office during this holiday period, and I'm struck by how people actually are wearing masks. When you put a mask on your face, you need to have clean hands. It needs to cover your nose and your mouth. Wearing a mask below your nose, wearing a mask off of your ear, wearing a mask below your chin is useless. And it gives you a false sense of security that you have something on that it's protecting you. It will not. It needs to be well fitted over your nose and your mouth. It's about making sure that you spend more time in places where there's better ventilation, either outdoors or inside where there's better ventilation. It's about businesses, workplaces, schools, governments investing in good ventilation. That takes investment, it takes time, but this is a good investment not only for COVID-19, but for other contaminants that are out there. And it's about making choices, about limiting your contacts with others, avoiding crowded spaces. These are really important right now. But we also need to make sure that there are national policies that support you in doing this. Staying home if you're unwell, making sure that there's good testing facilities that are out there and that people have access to reliable tests so that they know if they are infected, and if they are infected, to get into the clinical care pathway early, because early clinical care saves lives. To isolate and make sure that you don't pass the virus onto someone else. Alerting your contacts if you are a confirmed case. Letting your contacts know that they need to quarantine so that they, if they happen to be infected, that they don't pass the virus onto others. Basically, we are asking everyone to play a part in this. We are asking governments to have rational, evidence-based, tailored, comprehensive policies with a layered approach of all of these different types of interventions that keep people safe. Essentially, do it better. Do everything that we have been advising better, more comprehensively, more purposefully. We will not be in this situation forever. Your question was around Omicron and this wave that we are seeing right now. And it is really quite astonishing how well this virus spreads. But this variant, with the properties that it has and the increased transmissibility it has, it's also in the context of immune evasion, so people can be reinfected. It's also in the context of people mixing without measures in place. Any variant will thrive in that situation. So we need everybody to play their part and really focus on what you can do to keep yourself safe. So, thank you very much for the question. Just please be purposeful in what you are doing. Take the steps to lower your exposure to this virus. And again, keep in mind that all pandemics end. This pandemic will end as well. We need, as the Director General said, to ensure equity to tests, to therapeutics, to vaccines. And as individuals, you can fight for that as well. So please get vaccinated when it's your turn, and please follow the public health and social measures that can keep you and your loved ones safe.
May the interpreters kindly request Dr. Kerkhove to speak closer to the microphone. Thank you very much.
Certainly, Jimmy, we do agree that Omicron is more transmissible, but it's a relative increase in transmissibility. If we look at the secondary attack rate studies that have been done in the UK and in South Africa, I think in the United Kingdom we're talking somewhere between 10 and 16% further transmission within households. In South Africa it was slightly higher, and that may reflect the size of households in that situation. But certainly the increase in risk of transmission with Omicron in that setting was twice as high. So, for example, in the UK studies, I think it went from about 10% risk of transmission to 15% risk of transmission. In South Africa, similar. Also, people who have been fully vaccinated had a much lower risk of having a secondary transmission in their household. So there's lots we can do. Get vaccinated, recognize that the household is a place where you can reduce the risk of transmission, and many people have done that successfully by ensuring that if you're sick, if you're symptomatic, self-isolating until you're tested, until you get a diagnosis. If you're a contact, going by the national guidelines for your quarantine periods, and also be aware of the context that a lot of transmission, and we've all heard anecdotal reports, but there are a number of reports of large-scale transmission, in particular indoor crowded settings. And again, so it's the same basic things that Maria has said. It's knowing your risk. It's recognizing that Omicron is more transmissible. So the chances of you getting the virus in the same situation is higher now than it was before. But it's exactly the same behaviors that will protect you. You just need to do them more assiduously, more often, and you need to be more careful about where you go, how long you spend, where you spend your time, and how you protect yourself. There are no easy answers, but that's and it's a good message. And thank you for asking the question, Jamie. It's important that we get the opportunity to communicate with people around what will protect them, and it is exactly what protected people before. But I would say, and I'm sure everyone at this table would say, one of the best protections is to get vaccinated. If you're offered a vaccine, please take the vaccine.
Thank you very much for those answers. The next question comes from Belisa from W Magazine in Portugal. Belisa, please unmute yourself and ask your question.
Happy New Year to all. Thank you very much for taking my question. I received some information that I kindly asked to WHO to confirm or clarify about the discovery in southern France by the Mediterranean Institute of Infection at the University Hospital Center about the new variant of COVID-19. Is it true? France said that already resisted 12 cases of this variant. And if it's true, I ask, the vaccines that are being administered protect people from these mutations? Thank you.
Thank you. Dr. Van Kerkhove will start, and we may then pass to Dr. Kate O'Brien to discuss the vaccines.
Yes, so this vaccine, this variant that you're asking, it's this B1640. The earliest detection of this variant was detected in September 2020 in a number of countries. And there was a preprint that was published coming from researchers in France recently. This variant has been discussed with our technical advisory group on virus evolution, and it was characterized as a variant under monitoring in November 2020. And this variant does have a large number of mutations. Our understanding, it's not very well circulating. Within France, less than 1% of the samples that were sequenced in France are of this particular variant. There's two sublineages of it, the B1640.1 and the B1640.2. We classify both of those as a variant under monitoring. And this means that it's important that we track this, particularly because of the numbers of mutations that it has. But it isn't circulating widely at the moment. And the reason we classify it as a variant under monitoring is to raise awareness and for people to be on the lookout for that. So as more sequencing is done, and we thank governments and countries and researchers who have worked so hard to improve sequencing around the world, it's important that those sequences are shared on platforms like GISAID. And we should say in the month of December, more than 1 million sequences were shared with GISAID. That is unprecedented. And we need more of that to continue because that helps us track. So this is a variant that we are considering under monitoring. And if that were to change, or if that changes, we will be certain to let you know. But it is not uncommon for research to be done and for those preprints to come out and that information is shared with us. So it is really important. I do want to just highlight, and Kate will probably comment on the vaccines, but I just want to make the point that the vaccines that are available for COVID-19 work against all variants that are circulating, all of the viruses, the SARS-CoV-2 viruses that are circulating, and they are highly effective against preventing severe disease and death. And I think that's really important for the public to know. And as has been said many times, when it is your turn, get vaccinated, because it's really critical. Vaccines save lives.
Perhaps I'll just add a couple comments on the issue of this particular variant and the vaccines. As Maria described, not a variant that is increasing in prevalence, a small fraction of the strains that are circulating. And so the specific details on the performance of the vaccines, specific scientific evidence on the performance against this particular variant is still a matter to be evaluated. But the really important point here, as Maria said, and I'll just reinforce, is that their real intent, the priority for vaccine programs is the protection against severe disease, hospitalization, and death. And even with the Omicron variant, where we've seen substantial reductions in neutralization of the virus, the performance of the vaccines are still performing against that severe end of the disease spectrum. So we don't have an expectation that these vaccines would have reduced performance or compromised performance against the variant. But again, a minor circulating strain, and really it's a matter still of evaluation.
Margaret, can I correct something? Sorry, I said that the first sequences were first detected in September 2020. I meant September 2021. I think I can't believe we're in 2022. So apologies for that. But it was first detected in multiple countries in September 2021, and it was classified as a variant under monitoring in November 2021. Thanks.
Thank you for those answers. The next question goes to Nobu Sunaga from Gigi Press, Japanese Press, Berlin. Nobu, please unmute yourself and ask your question.
Thank you very much for taking my question, and Happy New Year to everyone. I would like to ask about the Winter Olympics in Beijing, which starts in 1 month. And firstly, could you tell us the WHO's assessment on the safety of the games? Is the postponing the event not necessary in spite of the spreading Omicron? And please, I'm sorry, but please let me ask the very simple second related question to Dr. Tedros. Dr. Tedros, are you going to Beijing as you did in Tokyo in the last summer on the occasion of the Olympic Games? Thank you.
Thank you. Dr. Mike Ryan will answer your question.
Thank you for the question. We've continued to work as we do with many organizations organizing mass gathering events around the world, and we've supported and worked with so many different agencies over the last 2 years, and we thank them for their partnership. As with the Summer Games, we've worked with the Chinese authorities and through the International Olympic Committee in order to provide technical advice on the safe operation of the Winter Games. The Chinese authorities have very strict measures in place, and they've released a series of different playbooks. We continue to review those playbooks with the IOC. I'm confident that given the information we have, that the measures that are in place for the Games are very strict and very strong, and we don't at this point see any increased risk of disease transmission in that context. However, as you know, China has been experiencing some pretty large outbreaks of coronavirus or COVID-19 over the last number of weeks, and you'll see that the authorities in China are taking a very strong approach to dealing with those outbreaks. So we will continue to monitor the situation, but certainly at this stage, given the arrangements that have been put in place for the athletes and by the organisers, we don't perceive that there's any particular extra risk in hosting or running the games. But obviously we will keep all of the measures that are being put in place under constant review.
Thank you. And we don't discuss travel of any of our staff. So we'll go on to the next question from Bianca Rotier from Globo from Brazil. Bianca, please unmute yourself and ask your question.
Hi, Margaret. Thanks a lot. Happy New Year, everyone. Yeah, my question is regarding Brazil. In Rio de Janeiro, for example, the number of cases increased by nearly 7,000% in 20 days. And there is a feeling there, and in some other Brazilian cities, I believe as never before, that everyone has someone close with COVID, a friend, a relative, a colleague from work, and many people are feeling lost. Unfortunately, some of them think that as the virus has changed, the necessary measures have also changed. You already explained that, but at this moment it's very important. What message could WHO send to Brazilians right now? How should they feel and react? What to expect? Is there a reason for panic or only concern? And then how big should be this concern? Thanks a lot.
Thank you, Bianca. Dr. Van Kerkhove will answer your question.
I think I'll start, and others may want to come in, but I think the big message that we have for all Brazilians and everyone around the world is don't give up. We are in this pandemic together. We will get out of this pandemic together. We have tools at hand that will end the acute phase of the pandemic. And what we mean by that is really gaining some control over this virus, so this virus doesn't control our lives. We have the possibility right now to reduce transmission significantly. Omicron is complicating that because it is so efficiently transmitting. You will see in our weekly epidemiologic report that will be published tonight that the change in the case numbers in the last 7 days increased at a global level by 71%. And it varies by region, of course. In the Americas, it increased by 100%. But in other regions, in the African regions, it increased by about 7%. Now, of course, we are severely hampered by the ability of testing around the world and access to tests. 9.5 million cases reported to WHO last week alone. And we know that that is an underestimate. Next week will be higher because in the last 24 hours, more than 2.2 million cases were reported. Having said that, given that there is this increased transmission and given that so many people we know are being infected, we need people to hang in there and really fight against this virus together. Be kind to one another and fight the virus and not each other. This is really, really critical because we are in this together. We do know that Omicron is causing less severe disease, but it doesn't mean that it is just a mild disease. Omicron is not the common cold. It can still cause severe disease, particularly among people who are not vaccinated. But of course, people of older age, people with underlying conditions, and we're just starting to do analyses on the data coming in from countries and seeing data from countries that exhibit this. But when you have a huge number of cases happening so quickly, it will burden the healthcare system. So what we need is everybody to play their part. And it first and foremost prevent the opportunity to get infected. And so getting vaccinated and fighting for vaccine equity around the world is so absolutely critical. But we need everybody's help. Don't give up, please, because you have a role to play and an important role to play. And whatever position you have out there, whatever leadership role you have, and don't be fooled, every single one of you out there is a leader in your family, in your community, in your job. Play a positive role in getting us towards the end of this pandemic. I think if you hear anything, please hear that and know that you can do something to get us closer to the end of this horrible situation.
Thank you, Dr. Van Kerkhove. The next question goes to Robin Millard of Agence France Presse. Robin, please unmute yourself and ask your question.
Thank you. It's now 2022 and we're more than 2 years since the start of this pandemic, which has killed more than 5 million people and blighted the health and lives of millions more. How optimistic are you that by the end of 2022, for those people, we will be any further forward in getting answers on how this pandemic began? Thank you.
I think that answer is in our own hands. The reality is, and I think the last 2 years has demonstrated, particularly with the arrival of vaccines, that we can significantly reduce the disease severity, significantly reduce hospitalizations, significantly reduce deaths through the equitable distribution of vaccines around the world, particularly to those who are most vulnerable. And vaccines have offered us the prospect, combined with the other measures, of actually finding our way out of the acute phase of the pandemic. And I say that, and the DG mentioned in his speech about ending this acute phase, this phase of death and hospitalization and disruption. The virus itself is very unlikely to go away. We've seen its ability to evolve and to stick around, and it will continue to do that. What we would like to see is a situation where the virus settles into a very low-level pattern, which may have occasional outbreaks in under-vaccinated populations. But certainly, if we can get close or achieve or exceed the objectives set out by Dr. Tedros, and first and foremost, we had and Bruce may wish to speak to this, the original targets of 10%, 40%, and now 70%. We haven't reached that 40% coverage yet in so many countries, and getting there right now is an absolute priority. We have seen, even with these huge numbers of cases of Omicron around the world and continued transmission of Delta, we've seen this decoupling of the incidence of the number of cases per day from the number of hospitalizations and from the number of deaths. We've seen the impact. We have seen this pandemic effectively come under control from the perspective of the disease and death it causes by the proper and strategic use of vaccination. Our problem is, globally, we have not distributed those vaccines in a way that we can do that job everywhere at the same time. And unless and until we get vaccines to every country, to every vulnerable person, to everyone who needs a vaccine, then I'm afraid we will be sitting here at the end of 2022 having somewhat the same conversation, which in itself would be a great tragedy. And that's why Dr. Tedros has called for a renewal of commitment, a redoubling of our efforts. And we've seen governments and industrialized countries go to extreme lengths to protect their own populations. And that is their primary responsibility, is to protect their own citizens. We've seen the push to increase vaccination coverage. We've seen the push for boosters. We've seen the energy that's been put in, the cost and the investment that's been put in to get vaccine coverage in many of these developed and industrialized countries to a high level. We've seen it can be done. The resources are there. What the DG is calling for today is for us to redouble our efforts and look beyond national borders and realize this is a pandemic affecting every country. And there's only one way out of any pandemic, and that's every country coming out of that pandemic. We will not come out of this pandemic unless and until we get the same level of control in every country. And that's why today Dr. Tedros is really calling for that redoubling of efforts. I don't know, Bruce, if you want to comment.
Thank you, Mike. I think to the point Mike made, and thanks for the question, Robin, you know, when we set out over a year and a half ago now, nearly, with the ACT Accelerator, when the Director General launched that, the goal was to get the countermeasures developed and distributed, especially vaccines, in a way that we could take the heat out of this pandemic, or take the teeth out of this virus. And as Mike said, these vaccines have proven incredibly effective in that regard. Kate summarized it earlier. They reduce the risk of severe disease, hospitalization, and the numbers we're seeing from some countries are staggering, right? Of the patients with severe disease, up to 90% of those are unvaccinated. So clearly, these vaccines are having a huge impact. So to Mike's point, you know, the big goal is take the heat out of this thing, make this thing a more, let's say, almost normal disease, if we can say such a thing. And we have the tools to do that. It's how we distribute them. So as we look forward to that goal of 70% of the population vaccinated in every country, the first step has got to be 10% in every country. 36 countries still aren't there. Many of them because they did not have the supply of the vaccines that they needed. Then there's another group who need international support to get their coverage. coverage up. And then as we look to the 40% target, and that really is the crucial one, because that covers your most vulnerable populations in all countries and your healthcare workers. 90 countries, nearly half the countries in the world aren't there, and they can't get there without the global solidarity that Mike talks about. And the solidarity, not just of countries, but especially of manufacturers who are making these vaccines. We need them to really prioritize the countries most in need. They are the ones that need the long lead times. They are the ones that need full sight on what they're going to be getting and when. So the solution to this, it's in the hands of manufacturers who make these tools. It's so important to the progress that's been made, crucial to getting it finished, but then to the countries as well who've got the financial means to support the countries that are struggling to get the vaccinators they need, the logistics they need to be able to counter the miscommunication and other issues. And, to the last point that Mike made, everybody now is acutely aware of the costs of failing to vaccinate. It's the arrival of new variants, of new challenges. So the sooner we get to equitable distribution, the sooner we get out of this pandemic. Could we do it by the end of 2022? There's absolutely nothing we've seen so far that suggests that we cannot. There is no need to finish 2022 in a pandemic.
Thank you very much for those answers. The next question goes to Tu Liu from Xinhua News Agency. Tu, could you unmute yourself and ask your question?
Hi. Thank you for taking my question, which is about vaccines. Dr. Abdi Mohammed, the WHO Instant Manager, mentioned at the UN press briefing on Tuesday the Omicron variant had mostly spread to countries that use the best-known vaccines, but there was no indication that other vaccines such as Sinovac or Sinopharm were not effective against the variant. So could WHO provide any specific statistics on the efficacy of the vaccines, particularly Sinovac or Sinopharm against Omicron or Delta variant? Or could you please describe the role of the two Chinese vaccines within the COVAX strategy, like the usage coverage in terms of the numbers of countries or populations outside China via the distribution of COVAX? Thank you.
Dr. Aylward will answer that question. Oh, no, sorry, we have two experts. Dr. Kate O'Brien will start and then Dr. Aylward.
Thanks so much for the question. We're monitoring extremely carefully the evidence on the performance of the vaccines against Omicron, again, specifically the primary interest in having vaccines that are protecting against the severe end of the disease spectrum. Since the Omicron issue has started, we've really been emphasizing that it does take time for this evidence to accrue. We now have 9 studies on the performance of vaccines, but many, many more studies on the laboratory performance of vaccines, in other words, the sera of individuals who have been vaccinated and the ability of those sera to neutralize the replication of the vaccine, of the virus, excuse me. We don't have any studies specifically on the 2 inactivated vaccines, Sinopharm and Sinovac, on their clinical performance, but there is some evidence on the neutralization activity. And like all vaccines, there is a substantial reduction in neutralization, but what we're really interested in is the clinical performance of the vaccines. I think the other really important thing to mention is that we also have evidence about the mixing and matching of vaccines, that now we know a lot more about when you have one dose from one product and another dose from another product, that in some of those combinations there can be better performance than, frankly, if you get the same product. So still early days for the 2 inactivated vaccines, and we would very much like to have a set of effectiveness data, clinical data on the performance of these vaccines, especially for the protection against that hospitalization end of the disease spectrum. These are really important vaccines for the global supply and have been, demonstrated their effectiveness outside the context of Omicron. So we really would like to have that evidence and are watching very carefully for that to come forward. Bruce, you may want to add a few things to that.
If you insist I make a comment on this question. I think first, thanks, Xinhua, for the question. The first point I make is, and it relates to one of the earlier ones that are made, when we think about vaccines and coronavirus, what we're learning is we shouldn't be thinking, does a vaccine work, yes or no? It's how well does a vaccine work? Because what we're seeing is all of these vaccines are doing what we need them to do, which is to save lives, prevent severe disease, hospitalization, take the pressure off the ICUs. As Kate highlighted, we have more data for some vaccines than we do for others, and we have to be very careful that we don't think an absence of data is an absence of impact. So let's be careful about that. And, you know, Mike made the comment some months ago that the best vaccine you can get is the one that you can get the soonest. And that remains the case today, right? Get that initial protection in place. You can always boost, as Kate alluded to, you know, with a heterologous boost and further boost the impact of these vaccines if needed. But the key thing is get that initial dose. And then in terms of the question about the use of the vaccine, through COVAX, we've shipped it to 49 countries, either the Sinovac or Sinopharm vaccine, and about over 180 million doses now, which is nearly 20% of the total vaccines that have been shipped through COVAX. So this has been an important part, as Kate alluded to, of the overall rollout of products around the world to try and boost immunity, save lives, and get in front of this pandemic. So important products, still learning about these products like we are about all products as we go forward. The other thing we need to remember as well, the virus continues to evolve, right? And these variants continue to evolve, and how it operates against one, as we're learning, may be different against others. So right now, we want to take advantage of the full armamentarium of vaccines that we have.
Thank you very much for those questions. We'll now go to Mexico, to Manuel Lino from EJE Central Mexico. Manuel, please unmute yourself and ask your question.
Hello, thank you for taking my question. It is how real is the increase in pediatric hospitalizations due to Omicron, and how worried should we be about it?
Thank you. That's one for Dr. Janet Diaz, our clinical lead.
Thanks for the question. It is an important question, and I think, you know, the data is still coming in from various countries, and we are grateful for the countries that are reporting that. With Omicron, we are seeing in general, what's looking like with the increased transmissibility of the virus, then we are seeing associated with that an increased hospitalization, and that's what people have been describing. And when we look, though, to see, is this different than what we saw within the Delta period, is also the analysis that's being done, and that's how we're trying to distinguish what is the severity associated with Omicron. When we look at severity, we look at a few things. We look at the rate of hospitalization, but more importantly, we also look about those patients that are hospitalized and require oxygen therapy, or those patients that are hospitalized and require intensive care therapy, and of course, the worst outcome, which would be death. So in the early studies that we're seeing from a few different countries, we are seeing the odds of being hospitalized during the Omicron variant circulation versus during a Delta period circulation to be reduced. So that means a reduced risk of hospitalization with Omicron infection when compared to Delta. And that reduction as well is being seen with the severity of the disease being observed. When we look at subpopulations, which is what you're saying in stratification, and so more data needs to be analyzed for this, but when we actually look at the stratification of younger people versus older people, we are seeing that reduced risk of hospitalization and the reduced risk of severity is also seen within the younger people and within children, as well as within older people and older So it does seem that it's consistent that reduced association with severity within the different stratified groups of ages. Now, why is that? There's still more to learn. There's more to learn in the analysis, taking into account the various risks other factors that may be associated with severity. One, of course, would have been age. The other one is the presence of chronic conditions, and the other one, whether or not populations have been vaccinated or whether or not they've had previous infection. And so many of the studies we're seeing now are starting to look and make sure that those analyses are robust and being adjusted for the other cofactors. With what we have seen, though, with the children that have been hospitalized with Omicron, that those that are increased risk continue to be those patients that have chronic conditions. So again, looking like, as we know for other variants, that when you have a chronic condition, that you're at increased risk for severe disease. So thank you for that question, but still lots to learn. And we do, again, thank member states for sharing data with WHO on clinical characterization, the clinical data platform, in order for us to do these in-depth analysis. Thank you.
Thank you very much, Dr. Diaz. The next question goes to Jérémy Lange from Radio France International. Jérémy, please unmute yourself and ask your question.
Thank you, Margaret. Good afternoon to everyone. There are reports, or mostly statements by some experts, that Omicron might be the last variant of the pandemic, considering the high level of infection and thus the high level of immunization among the population. I was wondering, how likely is this scenario to happen? Thank you.
Maybe I can begin. Maria, I'm sure, will supplement. I think it's wishful thinking, quite frankly, at this point. We saw with very high levels of transmission of previous variants and very high levels of seroprevalence, how Omicron was able to come in and exploit the immunity gaps that existed and that do exist around the world. So I think there still is a lot of energy in this virus. As Bruce alluded to, there's still billions of people, as the DG alluded to, who are unvaccinated. So there is still plenty, unfortunately, opportunity for this virus to spread and to generate new variants. We hope that doesn't happen. But at the moment, we're not doing enough to prevent that happening in terms of protecting people and in terms of distributing vaccine in a way that would assist with reducing the emergence of variants. The Delta variant, I remember at the time we had discussions, Maria, with various scientists who said, this is the fittest, best adapted virus that we've ever seen. We cannot see how this virus could adapt anymore, and yet it did, and we've seen a further variant emerge that is even more transmissible than Delta, which was itself more transmissible than previous variants. So no, I think it's premature for us to, I think it's not premature for us to hope. We can hope for anything. We should hope for everything. But the reality is we're not doing well enough yet globally to be able to say with any degree of certainty that we can avoid the emergence of new variants.
Yeah, I think, Mike, you often say hope is not a strategy, but unfortunately, I think it's very unlikely that Omicron will be the last variant that you will hear us discussing. Certainly, the virus continues to evolve. And if you recall, we have Omicron, and there's a lot of attention to Omicron right now because it is circulating so widely. In some countries, Omicron is replacing Delta. In other countries, Delta is competing quite well with Omicron, and it may take some time to determine, which variant will outcompete each other. But Omicron is very efficient. But Delta is also evolving as well. There are about 30 sublineages of Delta that we are tracking as well. We have meetings every single day with our member states, with researchers from member states who are analyzing and tracking circulation of this virus, the variants that they are detecting within their countries, some of which are variants of concern. And of course, Delta continues to be a variant of concern, but the virus is evolving. And as Mike just said, as the DG has said, we are giving this virus plenty of opportunity to circulate. And the more the virus circulates, the more opportunities it has to change. So I think, unfortunately, this will not be the last variant you will hear us discuss. It will not be the last variant of concern. There is some very important discussion that's being had right now about how much more fit can the virus become in terms of its transmission and its transmissibility. Omicron is quite interesting because it has so many mutations, and there are a number of factors of why Omicron is so transmissible. It has the mutations that allow the virus to adhere to the cell more easily and infect people more easily. We also have immune evasion, which means people can be reinfected, either from past infection or from vaccination, although it's still happening at a low level. And we do have evidence of replication of Omicron in the upper respiratory tract. So there's a number of factors that are happening. And the question is, what will happen as this virus continues to evolve, and what will those additional mutations mean? And there are a lot of very incredibly smart, compassionate, hardworking people who work with WHO through our technical advisory groups to help us discuss this and make sense of what we're actually seeing out there. So we are grateful for that scientific, that public health, that expertise, and that collaboration that's happening regularly. And the other question is about severity and whether or not any future variants will become more or less severe. There is no inevitability that the next variant will be less severe or more severe. We just have to see what happens as this virus evolves. But the big point is the less this virus circulates, the less opportunities it has to change. So getting vaccinated is critically important, and vaccination coverage in all countries, among those who are most at risk in all countries, is really critical, as well as driving down transmission as much as we can with simple public health measures that exist, proven public health measures, masking, distancing, avoiding crowded spaces, investing in ventilation, et cetera. Those two sides of that equation are really, really critical as we move forward, because this virus isn't going away, but there's a lot that we can do to minimize its future impact.
Let me just add on the last part of your question. We really have to have humility here as we go into this now almost third year of the pandemic. The last part of your question was about, we've got high vaccination coverage in a number of countries, but I think it's very worth repeating again that by the end of last year, 2021, what the DG had called for every country to achieve 40% coverage. And of course, there were many countries that were constrained from actually achieving that. There were 92 countries that did not achieve that 40% target. And of those 92, there were 36 that weren't able to achieve even 10% coverage, which means health workers, older people, people with underlying medical conditions, the very highest priority people still by the end of 2021, in spite of over 9 billion doses of vaccine administered around the world, had not been vaccinated. And so we really have to go into 2022, as the DG said, with not just doubling, but tripling, maximizing every single effort to assure that vaccines are getting to those countries that are still so far from the targets that we think are necessary in order to end the acute phase of this pandemic. It is vaccines, and as we're facing Omicron, it has to be all of the tools that we have, but we've got to get vaccines where they need to be. And I'd like to emphasize that out of the COVAX facility, in December, there were 320 million doses that were shipped into countries in that month alone. November and December together was over half of the shipments into countries for the whole of the year. So we are on the right trajectory, but that's only a trajectory if it continues. And so this really has to be a January that exceeds even those shipments. And that means manufacturers prioritizing COVAX and AVAT. It means donor countries who are sharing doses continuing to do that, so that those countries that are still below 10%, below 40% can get where they need to be and achieve the 70% coverage by the middle of 2022, so we can all get to the end of this pandemic.
Sorry to come back again, but I just wanted to, because Maria mentioned this, and I think it's important that we recognize the huge efforts made by scientists and laboratory workers around the world, because we talk about equity in one direction and sharing. We haven't done so good at sharing vaccines. But scientists in the world have done an incredible job of sharing knowledge, sharing sequences, getting that information and putting it on fabulous platforms like the GISAID platform, the NextStrain platform. And again, those are not, very often those platforms are funded through soft investments, and they're not very stable, and they need to be invested in at global level. But also now working to expand that sequencing capacity around the world. And we've been working with the G7, with the UK, with Germany, pandemic surveillance networks, and looking at the expansion of the capacity to do genomic and genetic sequencing around the world. Because this has been vital knowledge, because we wouldn't have a clue where we are right now with these various strains. We'd be so confused because we'd have all of these different forms of transmission going on, all of these different epidemiology happening. One of the great advances for us globally in this pandemic is that we've been able to precisely link different patterns of transmission or severity to specific strains, specific changes in the virus. And we've been able to predict potentially what these viruses will do depending on those genetic sequences. And we've had this massive outpouring of scientific knowledge and innovation. So this is really a message of hope in this pandemic. We have demonstrated collectively, and the scientists in the world have demonstrated, that it is possible to innovate, it is possible to share, and it is possible for all of us to benefit from that knowledge. And that holding knowledge or holding innovation in the hands of a few has no benefit to anybody in the long run. And I think our colleagues working in the laboratory sciences have clearly proven that it is possible to prosper and to share. I'd just like to shout out to those colleagues at national level, and particularly our colleagues in GISAID and in NextStrain and other platforms internationally who've worked selflessly over the last, I don't know how they've kept going, quite frankly, because they've literally dealt with millions and millions of data pieces to provide that information in real time to us and to governments around the world. So thank you.
Thank you very much, Dr. Ryan. We are coming up to the hour, so I think we've only got time for one more question, and that will go to Imogen Fuchs from BBC. Imogen, please unmute yourself and ask your question.
Hi, can you hear me okay? Thank you for taking my question.
Yes, we can hear you very well. Go ahead.
Okay. Yeah, just to go right back to the beginning where both Maria and Mike talked about the measures we all need to take, particularly with this very fast spreading new variant. Do you still really advise contacts of people who've been infected to go into quarantine? Because at the moment, that seems to be what is imposing an awful lot of stress, particularly on the health services. So many people who are just not able to go to work. Do you see any flexibility about how quarantine could work, or whether everybody actually needs to do it?
Thanks, Imogen, for the question. I mean, this global strategy that we have since the beginning is about reducing transmission, suppressing transmission, saving lives, and saving livelihoods. And part of the strategy is about reducing transmission, and quarantine plays a very important role in that. What we recommend, of course, is we need good testing systems in place to be able to identify cases so that cases can isolate. Patients need to be cared for, need to get into the clinical care pathway, but having the contacts of confirmed cases being put in quarantine or quarantining at home is really critical to prevent the onward spread. Now we know that that is very difficult to do. We know that that takes effort. People need to be able to not work and be supported in not work, be supported in quarantine to make sure that they can provide for their family, that they have food, et cetera, et cetera. And that is not a small matter. We have recommendations to continue for contacts to quarantine. Our recommendations include recommendations if you cannot do testing, but we also provide provision within our guidance to set policies that you can shorten the quarantine period if you add testing to that. And so there is some flexibility in terms of what can be done with quarantine, but it is a really important measure, and it depends on your goals. So the goals that we have set through our Strategic Preparedness and Response Plan, first published on the 4th of February 2020, and has been revised several times, quarantine plays a critical role in the prevention of onward spread. The policies that governments set and that they decide upon need to balance the prevention of onward spread and keeping societies open. So we recognize that, and we recognize that there needs to be some flexibility in the timing of quarantine, with the addition of tests, of course, if people are vaccinated. But it is important not to abandon that, because if we abandon, the isolation of cases and the quarantine of contacts, the virus will just spread. and especially in the context of highly transmissible variants, in the context of increased social mixing and social mobility, in the context of the inappropriate use of public health and social measures, in the context of conflicting and messaging and politicization, viruses will thrive. And this virus has shown us over and over and over again, alpha, beta, gamma, delta, Omicron, that it will take advantage of any opportunities it has to spread. So it's an important element of the global response.
And I think Maria's point is important here, the difference between science and policy. Science isn't the only issue that affects policy. Economy affects policy. The need for education of kids affects policy. The availability of health workers, the availability of frontline workers affects policy, and it is a trade-off between the two. The SARS-CoV-2 virus has a very wide range of incubation periods. Some people can take a day or two to develop symptoms. Some people can take up to 14 days or beyond. But the vast majority of people will develop disease within 5 or 6 days of being their last exposure to the virus. After that, the risk of developing the disease drops off exponentially. And as Maria said, we have made provision for countries that have testing to use some form of testing during the period of quarantine in order to shorten that period. The fact remains that a small proportion of people, for every day you reduce the quarantine, a small proportion of people will go on to develop symptoms and potentially affect others. But you could say that's 14 days or 40 days, and you can go into a very long period. So this is a trade-off. The science gives you a range, and that range peaks, I think, at about 5 or 6 days, and then falls off exponentially. So based on a country's need, based on the economy, based on the availability of teachers, health workers, and others, based on the availability of tests, countries have flexibility within that to set the periods of quarantine that meet their goals. And I think Maria is very specific in saying, what are your goals? You have public health goals, you have economic goals, there are social goals, there are educational goals, and you've got to find the right balance. And you've got the realities of whether you have testing available or not. You have the realities of people's lives and livelihoods, and whether people can afford to stay home for that long. In a country that has income support, that has sick leave, and all of those provisions in place, then staying at home for a week is potentially not a major imposition. Where you're working hand to mouth, where your next meal may come from your next day of work, then that's a different equation. So we leave it very much to countries to find that balance of what is the right period of quarantine that meets the public health and social goals in any given country. But certainly, and I think there is some evidence that the incubation period for Omicron may be slightly shorter, but it's not that much. So the equation really hasn't changed with Omicron. It really is a matter for countries to make that decision. And I know some countries are faced with that right now, and they should make those decisions as evidence-based as possible and be clear and transparent with their populations why they're making that choice. Please don't use science, in other words, policy-driven evidence generation. In other words, collecting the data that supports your new policy. That's not the way we want to go. The science is the science. And then you make a policy, and then you're transparent in those trade-offs, and you say to people, we're making this decision, even though we know the incubation periods can be longer, on the basis of our social and economic needs, we're going to shorten the period of quarantine and add testing. And yes, there will be some cases who will develop disease after those dates, but on balance, that is better for our society, that is better for our economy. I think that's a better way to communicate and make decisions, rather than go to the scientists and say, please find us the data that supports our new policy. There's been too much of that in this pandemic already.
Thank you very much. And on that note, we've well past the hour, so I will close the floor to questions. I know there are many more of you with hands up, and I apologize to you now. Do send your questions to Media Inquiries, and we'll do our best to answer them. We will also post the audio file and the Director General's remarks later this evening and send you the links, and the transcript will be available tomorrow. And with that, I'll now hand over to Dr. Tedros for his final remarks.
Thank you, Margareta. And again, Happy New Year, and Merry Christmas also to those who are celebrating tomorrow, and see you next time.